This is a short story about a little thing called meaningful use. Fact: the average doctor undertakes 25,000 hours of clinical training. And when you throw in the cost of med school debt, that's an investment of a lot of time and money. We get it. You just want to see patients. Practice medicine. But while you certainly get to spend some time here, that's not the only thing you have to deal with in American healthcare. Yeah, the painful truth is that government compliance requirements like PQRS, meaningful use, e-prescribing, and ICD-10 are taking doctors away from exam rooms and distracting care delivery. It really shouldn't be this difficult to heal patients. What doctors need is an electronic health records vendor that can put their practice on rails like a train, taking care of meaningful use so that they can spend more time in the exam room. iSALUS Healthcare was founded 15 years ago by a physician and a technologist, and if there's one thing we understand, it's meaningful use. iSALUS 100% web-based EMR is a certified Stage 1 and Stage 2 meaningful use program, which means iSALUS can meet your meaningful use requirements no matter where you are in the attestation process. And our meaningful use consultants provide free training to make sure you never miss a dime of meaningful use dollars or absorb any financial penalties for failing to meet meaningful use, which will happen if you don't attest for an EHR before the end of 2014. In addition to free training, you'll have access to a convenient step-by-step guide telling you exactly what to do to attest for meaningful use. Provider-specific dashboards measure all your meaningful use progress, with red boxes displaying where a provider is failing to meet requirements, orange boxes where they're close, and green boxes where they're achieving them. By clicking on a status box, iSALUS tells you the measurement, how to track a measurement under implementation, and what patients may be excluded. There's also a convenient hyperlink that takes you to a list of all patients that are missing the objective. This way you can correct any information that's missing and remain compliant. And printing meaningful use attestation reports or exporting CQM reports is only a mouse click away. With prominent system-wide alerts, iSALUS takes the guesswork out of meeting meaningful use. Simply click the red exclamation point and follow the system instructions to meet compliance requirements. By simply clicking the Resolve option, a screen is presented allowing you to update the patient data to meet the required measure. Michael Smith is missing language and ethnicity, so once we fix this issue, we can select Refresh and these will fall off the list. The process is truly on rails. Lastly, from the dashboard, each meaningful use measure links to the original Medicare documentation for your convenience. And that's how iSALUS Healthcare keeps you in the exam room.